People's Experience of Hospital Discharge, Episode 4, Kim.
So my name's Kim. I care for my mum, Carol, who's 76, and she was taken into hospital in February with shortness of breath and was in for 8 weeks.
Discharge.
I knew when it would be, providing she reacted well to the medication, but I didn't know anything else. All I knew there was a delay in providing care in the community, and she may have to remain in hospital for up to 4 weeks while that care was sought. We literally had a date the day before she was told her medications would be ready. Unfortunately, they weren't, but there was nothing. There was a conversation about some referrals were going to be made sort of to outpatients things, but there was nothing given to us. I did tell the hospital that we would have to seek private care to get her out because of her comorbidities. She was just catching more and more infections. The longer she was spending in a hospital environment, the more vulnerable she was becoming. So it didn't feel like a choice. As soon as she was medically fit for discharge, we felt we had to get her out of there, or there was a risk that she wouldn't be coming out at all.
Coming home.
A friend of the family picked her up and came home and stayed with her because she was incredibly frail and vulnerable. The only thing that was going to be in place was the private care that we'd set up ourselves externally, because otherwise there was nothing and she would have had to have stayed in. Our plan as a family was to provide the private care, and we did say it'd have to be short term because financially we couldn't afford for that to be a long-term arrangement until Reenablement kicked in. The private care that we had met every aspect of mum's needs, and it was really seamless. So a referral was made by mum's GP to the social worker to get social work support, but due to capacity issues that was delayed also. So Reenablement kicked in after 4 weeks, and the carers came in and started doing the assessment with my mum and assessed that she would need long-term care. We're still waiting for that long-term care to kick in. Reenablement are still in. It's now gone over to the rapid response team. I believe mum's liable to be in charge now for the Reenablement service, which still isn't the correct service to meet her needs until a long-term provider is sourced. Coordination of the services has been awful. I feel like as a family we've been left to navigate a massive system that we don't understand. After that I had to take 7 weeks off work to navigate through all this because I just couldn't do that and do my job. Initially it was all really disjointed, and it was lots of separate agencies. Mum's got lots of separate names and separate phone numbers that are ringing her and confusing her. She doesn't have a clue what's going on. There has now been a single point of contact created with the community matron, who's been fantastic and is helping us navigate through this system. Unfortunately, we're now talking 8 weeks since discharge and it's only just come into play. But we didn't find out that only through the district nurses who come to administer a blood thinning injection to my mum. And one of those said, let me refer you to the matron. So it's more by luck than judgment that we've now got to this place.
Impact of hospital experience.
When admitted to hospital with shortness of breath, my mum was still really independent, really active. Yes, she's got a number of health conditions, but was still able to look after my daughter on a Friday. The 8-week stay has left my mum in a wheelchair, has left her incredibly frail. Unfortunately, the infections were just coming one after another. The mental health effects for her. Her words kept saying to me, I'm never coming out of here, Kim, I'm going to die in here.
What's worked well?
The general care in hospital still felt quite disjointed. There was one professional towards the end of mum's stay that I had quite good contact with, and again that person helped coordinate who I needed to speak to in the hospital. But again, it was one person in a big system. The system felt like it was failing. This one person was going above and beyond what she needed to do, but purely on a sort of humane level of seeing how hard it was.
What would have made the experience better?
The challenges whilst mum was in hospital, I think, came from not having one named professional. So there was a rota of doctors, there was a rota of F1s coming in. You were speaking to someone different every day. Someone different was seeing my mum. Because my mum's a complex case, there was a lot of history. No one really had time to look into the history. There was no joined up working or thinking throughout that process. And actually that was evident then in coming out into the community as well. Everything felt really disjointed. I think what would have helped would have been sort of a named specialist that was overseeing mum's care and a particular team of doctors, so that they were aware of her needs and also her experiences that she's had previously that have led her to where she is now.
Thanks to Kim for sharing her experiences.